There are some patients that just stick out in my 20 plus years of doing this, and John is that one patient that really comes to mind. See, 23 years prior to seeing me, he was involved in a major car accident that left him with a fractured spine in his neck. Now, I'll show the x-rays here, and I have permission to do so, but you'll see that there's a wire in his neck, and that surgery saved his life, but the accident altered his life because he was never quite the same after that. In fact, he came in with massive headaches, migraines weekly, but an overall headache all the time. His left arm particularly was weak. In fact, his muscles have atrophied, gotten smaller. He dropped things. He actually lost a couple jobs because he couldn't perform them as well. His energy was just low. He only slept 4 hours a night for 23 years. Imagine what that would do to you. So, needless to say, he was at a loss. He was almost ready to give up. He was losing hope. And at that point, I didn't really know what I could do to help him, but I didn't tell him, like, I don't know. I say, let's see what the x-rays say. And I know he had some areas above that surgery and below that surgery and the rest of his spine that needed some attention. So we were diligent in being very careful on that area. So when I do take care of a person with surgery, and I've had surgery, I'm making sure x-rays are they're always going to happen. There is no, let's wait and see. It's always going to be x-rays to see what's happening. If we have to do CT scans or MRIs, we're going to do those as well. So I can understand exactly what I'm feeling in the spine. Of course, we're going to do physical exam. We're going to do computerized scans as well to see how the nerves are processing, not only the whole spine, but specifically that area too. I'm going to make sure that if I can help them, I'm going to be realistic with the goals. Hey, I don't expect this to be 100%. I don't expect you to be able to turn your head 100% if there's a plate in your neck, like before, if there's a cadaver bone. But we're going to help it so it doesn't progress even further. In fact, when people do have degeneration or do have surgery, often we'll see degeneration start moving up the spine very slowly. And the best thing we can do is keep that spine healthy so you don't have future surgeries to come as well, to keep that spine moving, because movement in the spine is a healthy spine. I'm also going to be realistic when it comes to their adjustment, saying, hey, touch that area, say, I know you've had surgery in this area, we're going to avoid this today, each and every time, so the patient knows that I know to take extra special care and to avoid that area, or what we're going to do to that as well. So if you do have any questions, if you were a person involved in an accident, surgery, maybe years ago, that just didn't clear up 100%, I'd love to be that answer. Let's just have a phone conversation, see if this is the right place for you. Until then, God bless.